Hi, my name is Bruno Gobato. I'm speaking from Brazil, and in this presentation we are going to show how we can do 3D printing and especially 3D planning for clavicle fractures. I have no disclosure for this presentation, and the objectives of this presentation is to show in a practical way how 3D printing and planning in shoulder and elbow surgery can be done, especially for clavicle fractures. We are going to show our real cases, and the purpose of this presentation is to stimulate the usage of these new techniques and this new technology actually for orthopedic surgery. Well, one thing that must be learned that 3D printing is the materialization of the surgical planning. 3D printing is not a device. 3D printing is not magic. 3D printing just materialize what the surgeon plans in his computer. So here we have some examples of 3D printing, modeling, and the planning of a clavicle fracture. We first started using 3D printing just to select the best implant for every fracture. For the first time we used this technology in past 2013, we thought that it was enough and it was good enough actually to have a model in our hands to manipulate, to understand the fracture, and to select the best implant. But using the technology, working with 3D models, we have learned that this is not only what we can do. We can have the model in the surgery, and we can use for example, here we are showing the location of the drilling for one of the screws of the plate, and we understood that the model could help us achieve a better surgery with less invasive techniques. And here is one of our first examples of using 3D printing and learning the best ways of practice. Sorry about the mess picture, but we understood also that we could develop patient-specific guides, patient-specific instruments to help us achieving our result. So here we're showing a very quick video reducing a fracture in a CAD software. Here we are using a CAD software called Rhino. Here we show how we can plan the surgery. We choose the best implant for every fracture, for every patient. Here we choose this implant. Here we have the 3D printing, as you can see here, and we have developed some small guides that adapt to the fracture site and show us exactly where to drill to drill and show exactly where the implant will be in the fracture, and why this is that important. First of all, we will have the plate in the exact position because we're drilling in the exact position, and it allows us to do minimally invasive cases because we don't have to reduce the fracture, because once we have drilled the lateral fragment and the medial fragment, we just need to adapt the implant to the pre-drilled holes, and the fracture will automatically reduce. So by doing that, we can use very small incisions, and we are sure that the reduction is as we have planned in the computer, and the implant is all along the clavicle fracture. Here is one of our examples of our planning. Today, we only go to the surgery with a planning. Not every surgery we do print, but planning is something that once you've done, you think that you are naked performing a surgery without a planning. And here is one of our first examples of a 3D printing clavicle and some guides. This is one of example, and here we show how we can do minimally invasive case without a fluoroscopy, choosing the right implant and performing the surgery using 3D printed guides. And here is the plate how we could use. One very important aspect of the 3D planning actually is for diagnostic purpose. We know that shortening and displacement of the clavicle is important. We studied that in X-rays we should do at least 2 views in X-rays, but sometimes some fracture can challenge us. This is a view of a fracture in AP view. If we turn a little bit in a Zanca view, in a cephalic way, we can see that we have some displacement, but if we do a CT scan, if we do a 3D model, it's not necessary to do a 3D printing, but if we do a 3D model, we can really understand that this fracture that seems to be simple is not that simple actually. It's simple, it's a simple side fracture, but have a very displaced and shortened fracture. So this is a surgical fracture. And with 3D planning, we can plan the surgery, choose exactly the best implant for that fracture, choose exactly the best fitting implant for every fracture. And here is one of our example of 3D printed clavicle. By today, we already print the clavicle with the holes where we plan to hold the clavicle. We print guide, and even just this is the plate, but this is the plate we have chosen, is just to make sure this is the format of the shape of the plate to be used a regular plate in surgery. And here is one of our videos showing how 3D printing sometimes can help us just choosing the correct implant. Here is an example of a Z-shaped fracture. It's a displaced fracture. It's a left side, you can see here. Here we have planned the surgery. This is how the fracture is displaced. We print the fracture without the intermediate fragments, and we also print with the pre-drilled location in order to match during the surgery the location for the screws. And we also develop, as we said, patient-specific guides for some surgeries that will help achieve the reduction of the fracture. Just as we can see here, this is our planning. And here we can see one of the guides. This is the guide that attached to the medial fragment that shows us 1 or 2 screws in the medial aspect. And then we have the guide being attached. In the left, we have the medial, and on the right, the lateral guide being attached. We choose to do a minimally invasive case just to look at the fracture side, to be to approach the fracture side, to place the guide. And by doing that, when we have the fracture drilled, we just place the plate along these 1 or 2 screw holes, and the fracture will automatically reduce, and we are sure that the clavicle and the plate will be all along the clavicle. Of course, this is a fracture that requires a anatomic position, so sometimes we lose these holes to do a minor adjustment with a clamp, and then we perform the rest of the fracture drilling. But this helps a lot. One of the things that we have learned planning this kind of surgery is rotation. Some fractures, not all, have a big rotational deformity. This is not one of them. This is a very regular fracture. Here we can see it's a regular fracture, displaced fracture. And here we can see that the fracture is displaced and it's parallel. This is a device that we attach to the medial and the lateral side. And all the fractures that we done, we move to reduce the fracture with this small 3D device to check for the rotation. And here we can see that this fracture had a displacement, shortening, but also a rotational deformity. In this case, I think we have 20 to 21 degrees of rotation. We have seen in our practice something like 45 degrees of rotation in a regular fracture. So be aware of that. The clavicle is a S-shaped fracture and is very, very difficult to understand rotational deformity. Of course, when we have a healed fracture or a non-union fracture, here is an example. The first fracture, the first clavicle we are seeing is a regular clavicle. And the second clavicle we are seeing in the middle, the C marked clavicle, is a clavicle that we have produced digitally with a 45-degree rotational deformity. And the D fracture, you see, has a 90-degree rotational deformity. We have digitally produced this deformity to show you guys that rotational deformity is very, very hard to understand looking only for the views, for the X-ray, and even with the regular CT scan. If you don't mirror the clavicle, if you don't look for some anatomical landmarks, we can have very high rotational deformity without knowing that that was in our patient. So be aware of that. Here is one of our examples that we have used 3D printing and 3D mixed reality. A patient that has a 78-degree rotation. This patient had already 7 surgeries prior to that. He has a very rotational thorax, very difficult to produce in words. I didn't film this patient because he did not allow me to show his image. But here we are using a mixed reality glasses. We are using the HoloLens. So we have placed virtually him in our office in order to study. This patient was not from our city, he was from overseas. And here we are with our students, with our team, trying to understand the deformity. Here we have in the medial side the corrected clavicle, and in the other part we have the deformity this patient had. And we have done all extensive measurements, overlapping, mirroring the right clavicle into the left clavicle to try to understand the deformity. And we check it more than one time that this patient had 78 degree. And here we have the surgery, we have the non-healing, we are using the HoloLens. Here we have on the right the projected hologram above the patient, and the use for 3D printing in order to try to achieve the rotational deformity. Well, what are the process to do all this is to have the image acquisition, segmentation, adjust, clean and separate the fragments, to do the surgical planning, and to do the 3D printing, augmented reality and mixed reality. The image, we need a CT scan, any CT scan with the DICOM files. We open these DICOM files in a software that does the segmentation. We use Invesalus, Horus or 3D Gym Viewer. These are all free apps everyone can see. In less than 1 minute, we have the CT scan read from this software and transformed into a 3D file that we can manipulate. So here we have some image of the Invesalus. It's very quick. We open, we just select the threshold to match the bone, and in 1 minute we have the 3D image, as you can see here, and we can export. Then we have to just adjust, clean and separate the fragments. So most of the time we are only, in this case, worried about the clavicle. So we just select the clavicle and delete everything, and we have to separate the medial and the lateral fragment to work with. We have done this with the app called Mesh Mixer, which is also free. The surgical planning is the most difficult part. where we are going to adjust or to reduce the fracture and place the implant and even create guides. For that, we can also use the Mesh Mixer. 3D Builder is a native Windows software. Everyone that has Windows 10 has this software. We can do a complete planning with this software. We can use online softwares called Vectory or a CAD software that's Rhino. That's my option. I think it's an easy software to work, but we have other options. So 3D printing is something that it's not for it's not needed to be for for big companies. We do our at home, myself, and this is the person that helps me. This is my son. So this is something that we do in our office to help us and to help our patients have the best the best surgical and the best medicine and orthopedics for our patients. Thank you very much and enjoy. My email is bgobato@gmail.com. Please feel free to send me an email or find me in LinkedIn. Bye bye.